All right, good evening and welcome to the last episode for the week of the program The Law of the People and Governance. This is the program that talks about government policies, how it affects the people, and of course gets feedback to the people, from the people rather to the government. So here on this program, we'll talk about everything that affects the people and of course, the policies that government makes, how it affects and also its effect on the lives of people. Of course, you know that recently there has been a ban, recently a ban why the federal government caused a UK ban. Well, Nigerians feel that the federal government may have stayed up that ban. And of course, the World Health Organization also had their hands in it. Doctors Association of Nigerian Medical Association and the Nigerian Association of Resident Doctors have fingered the federal government as the mastermind between the decision of the United Kingdom government to halt the active recruitment of health workers in Nigeria. And UK had weeks back placed healthcare workers from Nigeria and 53 other countries on the red list of nations not targeted for recruitment, citing the declaration by World Health Organization, which I mentioned earlier, as places experiencing workforce and facility challenges on their health sectors. And an immigration route favorite with many health practitioners in Nigeria. It has always come under fire of the federal government, with a bill seeking to impose a minimum 5-year stay in the country on fresh medical graduates passing second reading in the House of Representatives, both tracing its genesis to the meeting between the Medical and Dental Council of Nigeria, that's the MDCN, and UK's General Medical Council, GMC, last year. Well, they know that last year the MDCN registrar went to the GMC, and the report they got that time was that they discussed how to mitigate the effect of brain drain in Nigeria. So that is purely speculative, but they believe that it was part of what they discussed, and they can't confirm, but it was possible that he is on the same page. He told a newsman that it is possible the Nigerian government pushed for the restriction, but they have not seen any official release to that effect yet. And the MDCN chairman, Professor Abba Waziri, Registrar Dr. Tajuddin Sanusi, and even the head of department registration, Dr. Henry, met with officials of GMC last year, October, following the health regulatory agency, which spoke on the meeting via their Twitter handle. So they said they had a lot of useful discussions amongst which is the possibility of the government to repatriate some funds in line with global health initiatives, according to them. So we'll take a look at this and a whole lot of that on today's program. We have a guest who is on standby already waiting for us, so we'll go on a short break. When we come right back, we'll bring our guest on and we'll talk. So stay tuned. It's still the program The Law of the People and Governance here on Spectrum Television. My name is Rachel David White. Okay, so our guest is on standby waiting to join us all the way from UK, and of course she'll be telling us much about what we need to know, the face-off between the federal government and health workers in Nigeria.
Good evening, Rachel.
Okay, I must say I'm very delighted to have you again on the show.
Thank you for having me.
Okay, so the last time we talked about election issues, today we are going away from political issues a little into policies of government and how it affects the doctors here in Nigeria.
Okay.
Okay, yeah. Well, I believe that you've had what is currently going on in Nigeria right now. There has been a ban, of course, from the UK government to stop Nigerian doctors from being recruited in UK, although they haven't moved to ban them from other countries, but it just happens in UK. And this, according to them, is some reason, or the major reason is that the World Health Organization feels that there is need for Nigeria to have their doctors remain in their countries. Of course, you know, the health sector in Nigeria is one critical sector that the government hasn't really looked into. So we still have lapses, we still have challenges, major challenges. We still lack professional hands on the field. So this has actually stirred up lots of reactions, and also a law currently that has passed second reading in the House of Reps that, well, most of them should not. I think there's another one that came in, and this has really caused a whole lot of reactions. And also, the doctors feel that the federal government has a hand in the UK ban on them. What do you think about this whole issue? Let's start from there.
Yeah, okay. So I think the problem is about the situation of Nigerian fare and the condition of service. And if the federal government is not looking into their welfare and the infrastructures surrounding their work, I think it will be very difficult for them to practice in Nigeria. I could remember as far back as 2001, the African Union met in Abuja to set a target for all the members of the African Union to. But as at now, I still remember that in 2023 budget, the federal government were able to just manage to give the health sector 5.75% of their annual budget, which is far below the proposal of the African Union. And if you look at that, I think before that meeting in 2001, which is more than a decade ago, and at this point in 2023, they are just managing to why our health sector is not making headway. And the people that are in that area, they are not finding life very easy. Even the politicians, those people that are making the policies, they are not even managing our health facilities. They go out of the country to get that just because the infrastructures, the resources are not
in place. Okay. Dr. Nassar, can you hear me?
Yes, I can.
Okay, we'll get to that, because Nigeria, discussing about Nigerian health sector is a big thing on its own. I think this is something that several times there have been a call on the government to come take a good look at the health sector. One particular sector that the government hasn't paid enough attention to, and we'll look at that. But do you think that right now it's a good initiative for Nigerians? Of course, as the law for greener pastures over the years, it has been something that has happened way back over the years. It's not just a new thing. You know, health workers in the country should be concerned. It has led much compared to what you're doing. This is a sector that poses, or that puts the lives of these practitioners at risk. You can imagine, as a person who is not on that field, I always imagine things like, okay, for example, let's use the COVID-19 outbreak, okay? Now, when it happened, it was a strange disease, a strange infection that wasn't known to any part of the world, okay? It just broke out, and it was everywhere, here in Nigeria as well. So we still had doctors manage that situation. Something they don't know, they weren't familiar with. We saw doctors lose their lives, and those were people's family members, people's relatives, parents, mothers, fathers, you get. So I think this is one sector that puts the lives of the practitioners at risk, high danger, and they are still, you know, going out there to do this job diligently. I just feel that the medical field is one field that should be properly looked into. Why?
Yeah.
Many reasons. One of it is that you can imagine the life of a medical doctor. You know already, you're on call, even when you don't want to be on call. You have emergencies, you have to save life, you don't have a life of your own, you live your life for others. You have to save life first. That's your first priority. And this is a sector that should be looked into. Unlike the money being pumped into politics, don't you think that Nigerian medical sector has not had enough attention from the government?
Now, of course, they have not. That's just the truth.
But one
And
would be wondering, why is this so? This is a new age. Checkups outside the country, and then some people ask questions like, "Oh, he has seen those facilities outside the country. What stops Mr. President from saying, oh, I've been here several times. Let me try to bring this structure to my country, okay, so that people don't need to travel out again to go for this kind of checkups. They can actually do it in the country." We have some sectors that money is being pumped into enough, but aside from it seems two critical sectors in the country is underfunded, poorly funded. Are we still experiencing this barrier, this I would say poor funding for the medical sector? What could be the problem?
yeah, I think the problem is lack of knowledge of what to do in terms of our government, the misplacement of priority. Because, they say that a healthy nation is a wealthy nation. And if you put that into as well, because it is through education that all of those medical practitioners are educated to have their careers operation in that field. So I think the government are misplacing the priorities in terms of not paying attention to health sectors. Because if you see this, for instance, if you look at our country, they prioritize the subsidy, fuel subsidy. So, but if they should pay attention to our health sector, I think of our medical practitioners, they are in our country. But I think the politicians are not getting it right. As I mentioned earlier, the African Union, they came together to say that all the countries of the African Union should give 15% of their budget to health. But Nigerians are far below that. They don't consider it priority. Instead, I think it is all about our government. Because they go outside to get these facilities, I mean, to get these but they should remember that a healthy nation is a wealthy nation. When the Ebola broke out, it should have taught us a lesson in Nigeria, even before the coronavirus. But there was no lesson learned because they see themselves as people that can always go out and get whatever they want in any country they want it, forgetting that our people, who are the masses, they deserve better. And when these people, the doctors, you see them taking many jobs in private hospital, and as well as taking jobs in government-owned hospital. At the end of the day, their attention is not given to any of those because they are trying to make sure that onto our health sector. And when that attention is given, I am sure that our health professionals will be happy to stay in our country.
Okay, well, this is just a call on the people that this program is interactive. You can bring your contributions, of course. Feel free to call us. The phone number is displayed on your TV screen. You can send us a WhatsApp or a text message. Let's talk about the face-off between the healthcare workers in Nigeria and the federal government. Do you think that move was a smooth one, or do you think, as the medical bodies in the country alleged, that the federal government may have had a hand in the UK ban on recruiting Nigerian healthcare workers? Of course, don't forget that these people are trying to search for greener pastures where it pays better, which is a normal thing that works. For example, you go through a whole lot, you spend a whole lot of money to acquire knowledge, okay? Go outside the country to learn this basic knowledge in order to save lives, and then you come back, the money you get is not even compared to quarter of what you spend to get the knowledge in your country, and you're seeking for help somewhere else, going to practice what you learned in order to gain an income, and then there is a ban all of a sudden. I quite agree with the UK. It's a command from the World Health Organization, which they need to obey. Nigeria needs a healthcare sector needs attention. But what do you think about this whole issue? Feel free to join the conversation. The phone number is displayed on your TV screen. And we're being joined live from the UK by Dr. Chinasa, and we're talking about that. Let's get back to the doctor now. Hello, Dr. Nasa, are you there? It's the major reason most of the doctors want to see greener pastures. And this has equally led to the doctors having series of strikes and protests in the country. Well, and healthcare workers in the country, shouldn't we be concerned, have a major thing to worry about, okay, with addressing.
Federal government should be worried about, or what they should be thinking, is to improve the health care sector. And when this is tackled, I think it will, the doctors or the health practitioners will see the reason why they should stay in their country to practice. But when the welfare of the citizens or the health workers are not there, they are fighting for their lives. These people put their lives online for other people. You are aware of when a coronavirus broke up, and back then when Ebola broke up, and some of these health workers lost their lives because they put themselves in dangers in order to save others. And when their welfare are not considered, I think the best thing for them to think about as a normal human being is to look around and find a way out, because they are humans like us, where the doctors and all the other health care workers are being treated in a special way. They are being considered, they are being paid their remunerations, they are being paid their salaries. So they will look around and say, oh, I think it should be better for me to go and find my way outside the country. There is something that happened during I think that was before the election. There was an accident in Lagos, a collision between a bus and a train. And many people lost their lives, and yes, many people were going for work. They were not envisaging such condition. So at some point, something like that happened, and they have to have many people. And if you look at what happened, because I watched it, if you look at what happened, you will see that people that are not even part of health workers, ordinary people that doesn't even know how to start the protocols of how to country in order to find fend for their lives and their families. And remember that what they are earning is not good enough to even train people, because if you want to go to school in Nigeria just now, you have to consider like going to private schools where at least there won't be a
strike interference.
Yeah, there won't be strike. So for them to actually train their own children, they'll have to consider, what am I earning that will make me to give my children the kind of education that they need in the society. And so when they think about that, you will see that they don't have any chance. So what they do is to consider leaving the country. So and the federal government should just have everything, because if you look at the meeting of the African Union in 2001, and Nigeria is still implementing 5.75 of the annual budget to health sector. What does that tell you? It tells you that after 20 years, we cannot even get up to half of the proposed annual budget for the health sector. And that is why people are leaving. That is why, okay, if you want to go into the theater to operate a patient and some of the equipment are not available, and you will be there looking at this woman, they will lose their lives. You will feel pity. And what you do as somebody that has empathy is.
The UK government, though, did say Nigerian doctors and other countries blacklisted wishing to work in the UK can do so on a government-to-government agreement basis. Won't you say this is a way of salvaging the country's health sector, as losing your best hands could create health concerns for countries affected by brain drain?
There is nothing to salvage. You are just trying to kill it. Because if you want to salvage the health sector, what you do is to put money in it. Consider it when you are planning the budget. Change the infrastructures. You can imagine at the point when that accident happened, so many people were laid on the bay floor. So many people were managed to get some foam and so on and so forth. And somebody came out to justify that it is a kind of being practiced except in Nigeria. You can see a kind of an emergency and somebody is lying on the floor and moving the people on a bare floor, and you are proud to say that this is a global practices. I think we should be feeling ashamed of put money, prioritize health. A healthy nation is a wealthy nation. Prioritize education, because if you have good education sector, you will be able to train people in all aspects of human endeavors.
Okay. Doctor, it leads us back to talking about what you should prioritize and the rest. It leads us back to the argument that brain drain won't be an issue or a current norm if the government prioritized the welfare of health work witnessed in 2022. It was something else. And anytime this strike happens, okay, anytime it happens, people's lives are at risk.
Exactly. And what some of these politicians don't understand is that at some point it may happen to you. You may be thinking that, oh, because I have the opportunity, I can always go to Europe or America to receive this healthcare. But there is a kind of at the point of emergency. What do you think about yourself? What do you think about your loved ones when there is an emergency? So I think two things that should be prioritized in our society, I mean, in our budget, should be education and health. These are the two things I think should be prioritized. They should not consider this um, away from health professionals. Do you know that in Nigeria, some people will be sick, and because they don't even have money to go to hospital, because majority of where they can get attention is in private hospital, because of the money involved, they will resort to going to all these prayer houses, and at the end of the day, they will lose their lives.
Talking about affording healthcare services, there has been a call recently. There are women out there who cannot afford a proper family, how do I put, family planning, proper taking care of themselves, okay? Family planning when it comes to how many children do you want? Do you want to stop giving birth after having 2, 3, 4, or 5? So they keep going. And then some of them don't even know what works for them. Maybe the one that works for them cannot be affordable. And then talking about IVF, where it is also another way to have a child if you can't conceive the normal way. Okay, these are some of the things that are not even affordable. A common Nigerian cannot say, oh, let me try IVF, or let me go do this particular maybe method of family planning, or even breast cancer cures, a whole lot of that. I think there are so many challenges in the health sector. If there is
the government they have failed again in that aspect, because there is no health insurance scheme working in Nigeria. Because if there is a kind of health insurance scheme working in Nigeria, these people that you have mentioned will be able to have that insurance in terms of their health, so that they will be able to manage to get all of these things for themselves. So in other part of the country, like the UK, if you are just working and paying tax, you have access to health insurance. You go to hospital, you receive every kind of treatment that you need by yourself, whether you need that kind of IVF, or you need to have any kind of surgery, or any kind of treatment that you need. As far as you are a taxpayer, you have access in the UK, where they will pray for you so that you get well. It doesn't work. Prayer cannot cure cancer. Prayer cannot cure diabetes. It is there. It is good. What is required is scientifically manage the person. Scientifically, what is the medication for treatment of this disease? You go through it and you start receiving some medication. But because our government has failed the people, you will see someone that is having a known disease. The person will go to in Nigeria, they normally call it village people. That is the word they normally use. They say that it is village people. There is nothing like there is nothing like village people. What
Okay.
is there is that our government failed. That is why people, when they get sick, they say that their village people have remembered them.
Okay,
But there is nothing like
Doctor,
that.
let's even move away from that and talk about facilities. I mean, if you go to a general hospital, government-owned hospitals, you can hardly boast of going there. I mean, we've called out the government countless times to go and look at these facilities. I know that here in Akwa Ibom, the Akwa Ibom State Governor, in the person of Adomi Mano, has actually refurbished one of the hospitals and made it nice, and not just one, some other hospitals. But talk about the federal ones, okay? That the government should take proper take proper care, look at it very well. I've actually gone to check on someone in the hospital who put to birth, who passed through cesarean section, and then I mean you can't survive there for 2 days. A place where the bathroom is leaking, and then the whole floor is flooded, so that the women who just had surgery would just not be able to walk in there to ease themselves, so they just pass out around the place in order not to get into the filthy place, so it gets more filthy. Talking about the bed spacing, everything, a whole lot of these issues. The facilities being used as whole.
Yeah, I think the problem still lies in the budget. Because if the African Union has targeted 15% of the total budget for every country, every member country, and we are still on 5.75% of that, how are they going to put up all of these facilities? It is not going to be possible at all. Because if you want to revamp our health sector, there is need to budget for it. There is need to increase the percentage of budget that the healthcare receives. And when that is done, you will start seeing these renovations, you will start seeing these infrastructures they manage. And they will see their colleagues outside in the country being treated in a very good environment. They work in a good environment. They receive their salaries on time. They receive all their packages on time. And when these people, when you compare yourself, this is my classmate making it out there, they will start thinking of leaving. So what I'm saying in essence is that as far as we are still not.
Okay, well, the Nigerian Medical Association, that's the NMA, says the UK restriction won't stop Nigerian doctors from going abroad to seek work as long as their welfare in Nigeria doesn't improve. Do you think they are right in this assertion, considering the limitations this bill can bring to them going forward?
Yeah, I think if federal government actually mean that no, they have to consider their welfare first. If you have made their welfare to look attractive, then you can now place that restriction and it will make sense. But when you put a restriction on people that doesn't even have hope, what they do is to, okay, they will still manage to find one way of the country.
Okay, some persons have supported the idea that there should equally be a legislation to ban public office holders, elected, appointed persons, from going abroad to get medical treatment, right? And it has been a tradition for decades. Maybe this would force them to invest in their own sector. What do you think about this? We already, a whole lot of them going
Mhm.
out for medical checkups. It happens often. There are tendencies that the incoming president of Nigeria would be traveling out for checkups as well. And he already had been doing it even before coming into seat. So this is also being funded by the Nigerian government.
Yeah, I think they, to be fair enough, if they want to be serious in Nigeria, there should be a legislative. I mean, there should be a policy to actually say that politicians should stay in Nigeria to receive the medical attention that they need, so that if you are, yeah, you have to patronize them, use the facility in your country. I think, to be fair, they should have such policy.
You know, this also takes me to the question or the illustration where I made. I said the president has been going out for healthcare treatment for a long time. There are times he goes for months, and of course, the vice president has to be in the capacity, in the acting capacity, to stand in for him. And then one would be wondering, if I go to attend services, go to take proper care of myself, and I'm seeing this facility, I love it, this is what makes me feel better. What stops me from bringing it to my own? That adds to generation of revenue. It still goes back to the country's
Mhm.
pocket.
Yeah, I think Nigerian politicians should start thinking home, because in the UK, I have never seen Boris Johnson, when he was the prime minister, going outside the UK to receive some treatment, or the present prime minister, Rishi Sunak, going outside the country to receive treatment. It is only in our country, because they have rendered our health sector useless, and they think that it is not good for them. It is they would now migrate to another country to receive a very nice or a very standardized treatment. I am thinking that the best option is, just to be fair, if to receive treatment.
Okay, doctor, I think, well, I know you may not be in the best position to, you say, strategize or put those things in place, but what do you think, at least the sector, that the government can actually put in place to make Nigeria's own work? I mean,
I think
it would be sweet, like you said, the likes of Rishi Sunak or Boris Johnson, the former prime minister, or even you travel to your country to come receive um, healthcare attention.
yeah, I think the can you rephrase your question, please?
Okay, what do you think? Where can the government start putting things in place to make sure that the healthcare system here works? Um, you've mentioned the likes of the former Prime Minister Boris Johnson, Rishi Sunak, who is currently, and of course yourself. Okay, it would be a good thing to see you travel back to your country. Oh, where are you going to, Dr. Nassar? I have some medical checkups to do, but I'm going traveling to Nigeria for that.
Okay. I think the best thing to do, the best thing that the government should do is to increase the budget of the health the Ministry of Health. When that is increased, they should start thinking about reviving the infrastructures. When that is done, there should be a way of bringing down, reviving our community health centers. Because if you go to villages, some of the villages doesn't have even the community health centers. Then after that, you start thinking about research in health sector, because in this part of the world, what they sector, so that they will be able to understand how innovations and technology should come into the health the health sector, so that the health professionals will be able to use those technology or research findings to treat the people. If over here, what they do is to marry research or inclusive of research, they considers research as well.
Doctor, talking about research, I hope the network hasn't frozen you yet. We have, if there was a sector called the research sector, do you think Nigeria even pays attention to researchers? I mean, we see those things come from the other part of the world, and then Nigeria only taps from it. Do we?
Yeah.
So why didn't you practice that in Nigeria?
It's possible. It is very, very possible. Because I have thought about it in the past. I was like, most of our problem in Nigeria is that our our technology or indigenous technology, we don't consider a kind of research base. In all we do, we should consider research base. You can't just move into doing things without a kind of linking it, bringing research into it. The researchers will be able to systematically find a solution to the problem at hand. And I think research is part of what is lacking in our society. And when that is done, you will see that some of the innovations, some of the technologies will be they will be developing their own technology and innovation into the health sector, as well as
the big wigs in Nigeria who are in a position to, of course, make things work, like the healthcare sector and other sectors of the economy as well, which generates revenue to the country's economy. What would be your advice?
My advice will be that they should look into the budget of the health sector.
Okay, so you're hammering on
Make
the
it
budget. You think that's where the main issue is?
Yes. Because if you don't consider it in the budget, there is no way it can come in. If you consider that research is quite important in health sector, you consider it in budget. I
think you should rather say we should start from researching before we even realize that we need it, so it can be now it can be added to the budget as well.
Yes, yes. If people will they kind of make a thorough research, carry out a research to see how or the importance of adding, that is increasing our budget. It is simple. It is a kind of simple thing. For instance, if you had gone to market to buy the brown shirt you're wearing and you have 100 naira, I don't get it, maybe up to 15,000, 20,000 or 50,000. That is the only time you will be able to think of buying it. But if you just say, okay, I want to buy this brown shirt and I must go to the market with 100 naira, there is no way you can buy it. You will go to market, when they tell you that the price is 50,000 naira, you go home because you cannot afford it. So for you to buy that brown shirt of your choice, you have to make inquiries, find out about the money. Budget is to consider everything wholeheartedly, embed it in the budget, make our budget to be okay. You can imagine 15% as at 2001, and we are still in 20 years later, we are still having 5%, 5+%. It is quite disheartening. A known sickness, they won't even try to go for diagnosis. Instead, they will walk into a prayer house and say, and someone there will tell them that it is village people, and they will start shouting.
Okay, thank you so much, Dr.
By going to
Nasa.
hospital to receive.
Hello, doctor.
Thank you for
Okay,
having.
thank you so much for joining us on the show today. Well, I think that important thing to look at, of course, if the government pay attention to the healthcare system, they will discover that that budget is too small to carry everything along. And of course, look at the welfare, a call on the Nigerian government not just to place restriction of licensing, giving license to people who practice, you know, medical professions, restrict them for 5 years before they can be given license or before they can be permitted to travel. Not just placing a ban on them, but increasing their welfare status. If they know what it means, you're being forced to do something not because you want to do it, so you wouldn't be able to do it well. So I think the government should rather look into the welfare of the health workers, because these people are being put in a high risk almost every day, on call when they don't want to be on call, going out to and look properly into it. Thank you so much. If you've been trying to reach us, we're sorry if we couldn't connect to us. Well, this is where the show ends for the week, but trust me, next week we have a whole lot. Don't forget to follow us on social media and subscribe to our YouTube channel, all of which you can find on our website, SpectrumTv.ng.